So it's morning, you get out of bed, you shuffle into the bathroom to do your morning routine, you look in the mirror, and one side of your face is drooping. Bell palsy. Let's talk about it. First off, as always, I want to say that if you think you're having a medical emergency, I want you to turn off this video, call 911 and get yourself some medical attention. But if not, let's get to it. So your face is drooping. You're probably wondering, what is wrong with me? One of the explanations is that you could have Bell's palsy. So what is Bell's palsy? Bell's palsy, or idiopathic facial paralysis, is the paralysis of one side of your face. Sometimes it can be both sides, but that's rare. What are some of the symptoms that go along with Bell's palsy? So besides the paralysis or the inability to move the facial muscles on one side of your face, you might also be experiencing eye, ear, or face pain. You might be having blurry vision. You might be having difficulty swallowing, moving your tongue, or even tasting things. So what are the causes of Bell's palsy? Well, there is actually some debate about what causes Bell's palsy. Some causes, or some cases, are attributed to an autoimmune response, which means your body's immune system is attacking your own body. What causes an autoimmune response? Well, experts, I don't know if there's really a great explanation for why that happens. However, the autoimmune reaction or response is actually not the primary cause of Bell's palsy. The current thinking is that the majority of those cases of Bell's palsy are actually caused by viral infections, so viruses. In particular, the one most attributed to Bell's palsy is this herpes simplex 1 virus. That is not to be confused with herpes simplex 2, which is a sexually transmitted disease. Herpes simplex 1 is a very common viral infection that many people have. It causes cold sores on our mouths. And what happens is that our body fights the herpes simplex 1, but can't get rid of it completely. And what happens is that virus then kind of hides out in our facial nerves. And then when we are stressed or we are immunocompromised, so we can't fight infection very well, what can happen is that virus can reemerge, can be reactivated, and we can get those cold sores again. Sometimes that reactivation or that reemergence of that virus can express itself as Bell's palsy. So with that in mind, the people who are more prone or more at risk of getting Bell's palsy are adults with diabetes, people who are immunocompromised, so they have like they're fighting cancer and they can't fight infections very well. Women who are pregnant or have preeclampsia are other examples of people who might be at risk for Bell's palsy. There also seems to be a link between family members. So if someone who's in your immediate family who has had Bell's palsy, you have a higher likelihood of having Bell's palsy yourself. So there's that genetic component. All right, so what we're looking at is an image of a human head with the skull and the brain. These colorful pathways here represent our facial nerves. In that, as you can see, we have two pathways. One pathway starts on the right side of our brain and travels across to the left side of our brain. The other pathway starts in the left side of our brain and travels down through the right side of our brain. So what experts believe is happening is as the nerve pathways move from the brain to our face, it must go through this section here, the facial canal. In the facial canal, the nerves go through a tiny opening in the bone. If a viral infection results in inflammation or swelling in this area, the nerves will push up on the bone. When this happens, the nerves become pinched off, and the electrical responses that travel up and down our nerves become cut off or inhibited. This will result in the symptoms that you're experiencing. So is Bell's palsy a condition that you should get medical attention for? I highly recommend that you do. And to help answer the reason why, I want to take a look at this picture right here. As you can see, we have a picture of a woman. On the right-hand side, we have the picture of the woman. She's perfectly normal, beautiful, no problems whatsoever. Now on the left side, we have the same woman, and what we're going to do is we are going to put a line down the middle of her face. This woman has Bell's palsy. On the left side of her face, you see that she has full function of her face. She's able to smile, she's able to scrunch up her nose, she's got control of the muscles around her eye, she's able to have expression, emotion. On the right side of her face, all that is lacking. She's unable to grimace or smile. She's got drooping in her nose. She doesn't have any muscle involvement around her eyes, so there's kind of looks like this bland, blank stare. So now I'm going to pause and ask you, is there another medical condition that looks like this or mimics Bell palsy? If you said stroke, you are correct. Stroke is a very serious condition and can look a lot like Bell palsy. I've worked in the emergency department for a very long time. I've seen a number of strokes. I've seen a number of cases of Bell palsy. And if I have a person like this woman coming in looking like she does with her face drooping on one side, even if I have reason to believe from her story that she has Bell palsy, I work off the assumption that she has a stroke until proven otherwise. The reason being is that there is a very narrow window of time that treatments can be started, or some treatments can be started for stroke. If that window of time is not met, you could have some very serious long-term deficits, complications, or even death. So stroke is nothing to play around with, and that's why we take it very seriously and think of it as a stroke first before we think of it as Bell palsy. So can Bell palsy be treated? Will I have these symptoms forever? Well, the majority of people recover completely without any complications over the next couple weeks to months. There are a select few, however, that will have some lasting complications or deficits. 30% of people will pretty much recover all the way. They will have no cosmetic issues. So like if you were to look at their face, they would have no droop or anything like that. But they might have some underlying complications, so they might have some residual pain or numbness, tingling in their face. They might have difficulty producing tears in their eye or produce too many tears. They might have dull taste when they eat food and things like that. 5% of people, however, have what are considered unacceptable levels of permanent deficit or complications. So what are the treatments for Bell palsy? Well, the first line of treatment is a steroid. The steroid of choice for most doctors is prednisone, but your doctor might prescribe something different. But studies have shown that if you start steroid treatment 48 to 72 hours after your symptoms have started, you are more likely to return to normal without any complications than if you don't. And quite honestly, that is reason enough for me to go ahead and seek medical attention as soon as possible, even disregarding the possibility that it could be a stroke, right? The doctor also might prescribe an antiviral like acyclovir. And they will do this if they suspect that there is some sort of viral involvement. Studies have shown that when you take an antiviral just by themselves, it doesn't do much good. But if you use it in conjunction with a steroid like prednisone, the benefits are even greater than if you just take the steroid by themselves. So your chances of returning to your normal self is even greater than if you just take the steroid. Now, if you're one of the unlucky 5% and have some permanent conditions or complications in spite of taking those steroids and antivirals, there are actually some surgical treatments that can be done. I'm not going to talk about them right now. If you're in that camp, talk to your doctor and see what those options are. Another question you might have is, are there any non-pharmacological or non-drug treatment options for Bell palsy? And the answer is not at this point. There are some studies that have addressed acupuncture, and unfortunately the results were kind of inconclusive, so they basically just need more studies. So experts say at this point that if you wanted to pursue things like acupuncture, is not harmful in their opinion, but don't do it in lieu of traditional recommended therapies. Do it in conjunction, so alongside or with those steroids and antivirals. Also, your doctor might refer you to a physical therapist, an occupational therapist, speech therapist, something like that. And why would a doctor want you to see one of these specialties? Well, he might want you to see a physical therapist so that you can do some exercises with them to help regain motor function or be able to use the muscles in your face. They might want you to see occupational therapist or speech therapist if you're having difficulties with your tongue, so you can't speak very well, or you're having difficulties swallowing, you're drooling, things like that. And they can help you with that realm of medical issues. Make sure you take medications prescribed to you as directed. Some of the steroids that are prescribed, like prednisone, are often prescribed in a tapering dose. And what that means is they will give you initially a higher dose for a couple of days, and then they will have you take a lower dose for a couple of days and then lower it down again until the prescription's gone. And what's important is if you don't take it as directed, or you stop at mid-prescription, that can lead to some unwanted complications. Another issue that needs to be addressed is your eye. As I had mentioned before, with Bell palsy, you are going to lose potentially the ability to move the muscles around your eye, so you won't be able to blink or close your eyelid. Or you may not even be able to produce tears because of the Bell palsy. That puts you at risk of having dry eyes, getting scratches on your eyes, or developing ulcerations, so that's like skin breakdown of your eyeball. So because of that, the doctor might prescribe lubricant or eye drops, or they might just have you go to the corner drugstore and buy some over-the-counter artificial tears. They might even send you home with an eye patch, which you would use to help protect your eye, to keep your eyelid closed. If it's really bad, they might even instruct you to kind of tape your eyes shut. Put some tape and close that eyelid while you sleep. Well, that pretty much does it for Bell palsy. I hope you found this video informative and helpful. If you did, please give me a thumbs up by clicking that thumbs up icon below to let me know that you liked it. If you haven't yet subscribed and you like what I'm trying to do here, please click that subscribe button. And then while you're down there, go ahead and click that notification bell as well so that you know when I send out any new videos. And finally, I welcome any questions or comments that you guys might have. So go ahead and leave those in the comment section. I love reading them and respond to them whenever I can. Well, I hope everyone has a good rest of their day, and I hope you all stay healthy. See you next time. Bye.